Hello everyone, my name is Ishmael Mohammed. This is my informative speech. Section 14462, we're speaking today about chronic kidney disease and preventing kidney failure. Kidney failure can kill you and me. 37 million people are estimated of having CKD and they don't even know it, chronic kidney disease. Life expectancy is 5 to 10 years, average life expectancy. And why we're here, to how to prevent kidney failure. What is kidney failure? What is the treatments for kidney failure? How can we prevent kidney failure through blood pressure and sugar checks? Eating healthy and exercising. Diabetes and high blood pressure is the number one things that cause kidney failure. Diabetes is number one, high blood pressure is number two. What is kidney failure? Kidney failure is when your kidneys are not able anymore to get rid of the toxins and the fluid, which is the urine in your body. So what happens is the fluid goes into your tissues, and we're built of tissues. So it goes in your legs, your torso, your stomach, your face, your hands, and your lungs. So how it kills you, it goes in your lungs and you basically drown from that, or you die from poisoning from the toxins in your blood. So that's how you die from that. What is dialysis and the treatments of kidney failure? So a patient, this is a dialysis patient getting treatment, and usually they will go 3 to 4 times a week to get dialysis treatment, and it will be 3.5 or 4 hours depending on the order. So this is the kidney right here. This acts as the kidney, and you see the needles here, the arterial and the venous needle. So the arterial pulls the blood out, and the venous returns it. Goes through here, and you clean out, you take out the fluid and the toxins, and replace with new electrolytes also. So this is a dialysis machine, just like the last one, same thing. Basically, so you'll see the patient's treatment here is about 3,500. He's taken off of liters, 3,500 liters, 3.5 liters for 3.5 hours, and he'll be taking about a liter off an hour. So this is another dialysis machine here, and the reason why we're showing this is for the baths here. You have the jugs here, this is bicarbonate and this is acid, and the acid and the bicarbonate these are the electrolytes. So you have the acid has the sodium, the calcium, magnesium, acetate, potassium that you do the exchange for. Okay, this is a patient here that has a catheter in their chest, and it goes all the way to the heart, and then you can see it here. And primarily, you can get more infections with this. So they try to do a fistula or a graft. And the difference between a fistula and a graft is you have a tube in here, and over here is where they try to use your own vein, so they can put needles in your own vein. So the artery is attached to the vein, so the artery could push pressure into the vein to make the vein bigger, so you can stick the needles. And this is how it goes. Your blood flows through here, it gets cleaned, and then you return it to the arterial, to the venous needle. So it's the same thing. You have a catheter and you have a fistula or a graft. That's where, for the arm. How to prevent kidney failure through regular blood pressure and sugar checks. So you can see here, if you don't have any chronic conditions, 3 years, you should get a physical every 3 years at minimum. Now, if you have chronic issues, it would be, or you're pre-diabetic or pre-hypertension, you should see the doctor yearly. if you are a diabetic and you have you're type 2 diabetic, you should be getting your sugar checked once a day. And if you do have high blood pressure, you should be checking your blood pressure twice a day. If you are a type 1 diabetic, you should be checking your sugar 4 times and 10 times a day. Eating healthy and exercising to prevent kidney failure or the renal doctor. You want to keep the renal doctor away. So dieting, if you don't have any chronic conditions, you should be exercising and dieting on a regular. That's one, we want to prevent kidney failure. So that's one way to help to prevent kidney failure. If you are pre-diabetic or hypertension, you want to start exercising and you want to start eating, correct, because you want to try to, keep yourself away from getting kidney failure and keep yourself away from getting diabetes or hypertension. So that's one way of doing it. Eating correctly, keeping the salts down, the sugars down, the carbs down, and exercising 30 minutes a day or at least 3 times a week. And if you are a diabetic and you have diabetes and hypertension, then exercising and dieting and obviously taking your medication is part of that. You have to do that because most kidney failure patients are diabetic or hypertension. The number one cause is diabetes, and second cause is hypertension. In conclusion, you want to see a physician on a regular, yearly or 3 years, so you can protect yourself from kidney failure. And also dieting and exercise will be the second key. As we stated earlier, 37 million Americans are estimated of having CKD and don't know it. This is 7 to 10% of the population, which looks little, but in my work, I see a new dialysis patient almost every day, almost every week, and that's kind of scary, and it's increasing. So it states here, a person and 1 to 3 adults that have diabetes end up with kidney failure. And it says in 1 to 5 adults that have high blood pressure end up with kidney failure also. So, and then another thing is here, you can see it says 2.6% increasing every year. And also Medicare is a very big issue here. Medicare is $120 billion between CKRD and ESRD, which means end-stage renal disease. And this is in taxes and stuff, but the most important thing, we want to protect ourselves from kidney failure because it's a very big life-changing situation. And that's my conclusion of my presentation. Thank you and have a good night.